Okay, so I have Willen and Noe here from what part of California?
Whittier.
Whittier, okay, famous Whittier. Was the Whittier earthquakes? Were you living there during the earthquakes?
Yes. Back then, yeah.
Did it shake your house?
Yes, it did.
Yeah. That's how I think Whittier, right? I think
Whittier,
that was my memory of it. So you both have a history of being truck drivers.
Yes.
Now you're retired, but you still drive a truck. What type of truck do you drive?
I drive a semi.
Yeah. And do you do short days where you come back the same day, or you go away for a couple days?
I do local.
Yeah.
Ports. I go to the ports.
How long have you been in that business?
About 5, almost 6 years now.
Okay. And what is the main goal today? Like, why are you coming here?
Well,
And I'm glad you're here. I'm grateful. But I want to know in your own words what made you think, hey, I'll just check this guy out in New York.
well, we saw you first on YouTube, and I said, this is what we need.
All
we
right.
need to go see Doug. And all my life, this side can never breathe. Never.
Yeah.
Always cough.
Can you get some air through it now, or is it very limited? Not much.
Nothing. And then this side,
Not so great either.
yeah, a little
Like
bit.
the good side is not great,
Yeah.
but the bad side's bad. And how about you? You have something similar, right?
Yeah, it's this side.
Left
It's
side.
Always, like, it's every time I lay down, I can't, like, it just gets like like stuffy.
Yeah. And do you remember that being for years, or is it more
Since
recent?
I was a child.
Okay. And we're going to do full body adjustments. Does anybody have any neck pain or back pain or?
Definitely.
Okay.
Whole body hurts.
Just recently.
Yeah. I mean, a lot of hours in the truck too
Yeah,
throughout your
my
life.
back, my neck.
Yeah.
Yeah.
Okay. Let's get cracking. So I'm going to put this on to start stretching your back. How'd you get this big scar on the back of your head?
Accident.
Yeah.
Yeah.
He's had a few accidents, right? You broke your heel once,
Yes.
and this one must have that must have bled a lot, right?
Oh yeah.
Can you feel how intense that is?
Yeah.
Is it too much?
No. I know it's tense.
If it's too much, you let me know, okay?
Okay.
You feel how it makes this whole back twitch a little bit when I dig in? Do you notice that? So if I dig in here, oh, the defib is twitching all the way down here?
When he lays on his stomach.
Oh, it makes it jump more.
It thumps.
Are you okay in this position, or should we turn you over? Are you worried about it?
No, I'm not worried about it.
So he's got a pacemaker defibrillator on the right here on his chest, and he's saying that it's when he lies prone on his belly, it makes his body jump a little bit.
It thumps.
It thumps, and you can almost see it here. Watch. Come look.
Yeah.
You see right here?
If I take a breath, it'll stop.
So take a breath.
But when I blow out, it starts again.
I guess you have to breathe. Right?
yeah.
We'll let you breathe today. Probably their main reason for coming today, besides hanging out with me, but was the CFR, the breathing thing, right?
Yeah.
Ooh. You feel those cracks?
Yeah.
Did that feel good?
Oh yeah.
Why is this ankle thicker than this ankle?
The right one?
Yeah.
That's where I got the.
That's where you had the broken heel?
Yeah, that's where I have a shattered hip with a plate. There's a plate.
There's a plate in this side?
Yes.
Okay.
Yes.
So what I'm feeling is this is much thicker than here. This feels normal. This one, yeah. So that has to do with that injury. Hold my hand. Drop your head. I'm going to bring this knee up like this. This leg straight. Good. Let me have you here. Relax. Okay. Other side, please. You feel that?
I felt it.
Yeah, good. Lie on your back. Big breath in and blow it out. You feel that?
Yeah.
Where'd you feel it the most?
My shoulder blades and a little bit on my neck.
Yeah.
I heard it on my neck.
Does that hurt where your chest is? Does that?
No, that's fine.
You feel that?
Oh yeah.
Good. Perfect. Whew.
Wow.
All right, I'm going to have you come stand up for a second, okay? Camina.
Walk.
Yeah, he speaks Spanish. No, he told me you don't.
Yeah.
How do you feel? ¿Cómo te sientes?
My neck loosened up.
Yeah, a little better, right?
Yeah, loosened up.
Good, good.
I heard a lot of popping.
We're going to do the nose in a minute. I'm going to start with April Lynn. Will you get tight in here, right?
Yeah, I can
Wow.
feel it. Just laying there, it hurts.
I'm sorry. First, I'm going to dig into some of these muscles, okay?
Mm-hmm.
Can you feel how the table's moving up and down?
Yeah.
It's just flexing this a little bit. Opens up the back. How long have you guys been married?
2019,
Yeah.
about 6 years.
That's nice.
The end of 2019.
Big breath in and blow it out.
We've been together since 2011.
Oh, so you've been a couple for a long time.
Yes, yes.
Did you meet through your profession, like through
Yes.
trucking?
Yes, I was trucking, and I was doing paving, highways,
Mm-hmm.
dump truck driver,
Yeah.
and we met in Gallup, New Mexico.
On like while you were on an
I was
assignment,
out-
right?
I was out, yeah, I was going out for about 3 weeks, 4 weeks at a time, and stay in hotels.
Oh, you were on long hauls, long shifts.
Well, all around New Mexico,
Yeah.
doing the highways, paving the new highways.
And then what were you doing?
Oh, it's a waitress.
Oh, you weren't a trucker then.
Back then,
Oh,
Did you hear that?
yeah.
Which is so good. Did you hear that? Yeah. That was crazy. Did you hear all those cracks? Did that feel good?
Yes, I've been
Good.
needing that for a
Good.
long time.
Now you don't have any bad heels or feet, right?
No.
All right, come down a little lower on the table. And then he was the one that told you maybe you could try driving trucks.
Yeah.
I guess it's better money, right?
Yeah.
Was it hard to learn how to back up those big trucks?
Yeah.
I think I'd have trouble with that, like
It was hard.
backing it up, right? But she got it right away. Wow, did you hear that?
I heard it.
So how many years have you been truck driving? Like 10 years?
6 now.
Yeah, but you do the big, gigantic semis, right?
Yeah.
Do you know what you haul? Like, do you haul food
I-
mostly, or
I work for Living Spaces.
what does that mean?
Living Spaces?
What's a company?
The
Like furniture.
Yeah.
That was a good crack too. Did you hear that
Yeah.
one? I'm gonna try to do a pull with my bare hands, okay?
Okay.
Okay. No way, I'm gonna have you hold her ankles down like this, okay? So first we'll pull her a little bit, and now you can compress right there so she doesn't slide. Big breath in, and blow it out.
Oh, I
Did you
felt
feel
that
that?
one, yes.
Where did you notice it the most?
Right, like in the middle, like right here
Good.
on my upper back.
Just tell us how you feel now. A little better?
Oh yeah, I feel light.
Oh, good.
Light. Like,
All right. So her left side is the block. Let's see.
oh, I felt it like jolt like this way.
Yeah, I moved the
Yeah.
septum over with my bare hand.
Yeah.
Take a breath now. Any difference?
Yeah, I was telling her that this side was already clogging up when I laid down.
Are you getting better passageway now or not yet?
It's still a little bit stuffy.
All right, but is there any shift? Because I moved that bone over.
Yeah.
Move the cartilage over. Right side first, okay? You can stand up and come closer in a way if you want. Whenever you're ready, open your mouth, take a breath, and close your lips.
Oh.
Whew. What did you notice? Did you feel a crack?
What did you feel?
Yeah, I felt it cracking, like open the airway.
Yeah. What part of your face did it crack? Can you point to it that you remember?
Like right here.
Yeah.
Yeah, like right here.
Okay. So you ready to do the left side?
Yeah.
Okay. Whenever you're ready, you're going to open your mouth and close.
Oh, I felt that one.
That was the tough side. Here's
Yeah.
the tissue. Here's another tissue.
Oh.
That was the hard one?
Yeah, that's
Yeah.
the bad side.
Yeah, that one I felt it more than this side. This one I felt it like open, like squeeze it open,
Yeah.
like
And did it crack
and
too?
like it
Yeah.
moved over. Yeah.
Good. What's breathing like right now?
I can breathe.
Good job. You okay?
Mhm.
I'm going to have you come sit up. Experience breathing again. It's not going to be perfect. You both probably need like 10 sessions, but you don't live here.
Yeah.
So we're going to do as much as we can today. I'm going to move over to No Way next. We can do a maximum of 6 balloons per person per day. So we did 2 balloons on you.
Okay.
We could come back and do 2 more. We can come back and do 4 more if you want. We do 2 at a time, right, left, or left, right. It doesn't matter where we start. Okay?
Okay.
How do you feel now? Do you feel like you're going to want to do 2 more, or you'll wait a few minutes and see?
I'll wait a few minutes.
All right, good. So I'm going to have you switch seats with this guy. I need the weight of your head on this. Let me pull it out. Don't pick your head up. So look, we're looking, actually you have 2 blockages. So yours is a little complicated. You got high on the left and low on the right. So first I'm going to just take it this way.
Ooh.
I felt it.
I want to see if there's one last one on here.
Oh. Oh, yeah.
I'm going to start on your right nostril because your left one is worse. You okay? Whenever you're ready, you're going to open and then close.
Oh.
I'll get it. Here's tissues for your hand, okay?
Oh.
Did you hear a crack?
I heard, yeah. I felt it. I felt it open, crack.
Okay, we're going to go right to the left side. Whenever you're ready, you're going to open and then close. How'd that one do?
I heard it.
What are you experiencing now?
Trauma? Nah.
No, it is traumatic. That's honest.
It opened.
Right nostril, we're going right upper. Oh, I got a good placement. Whenever you're ready, open and then close. You okay?
Oh,
Get more tissues.
this was a bleed. That was gonna bleed.
All right, we're gonna get this done in case.
Wipe your face just a little bit. It's good to put on it. There you go.
All right, here's the last one. I don't think you should do more than this. This is good for today. Whenever you're ready, you open and close. And you can sit up right away. What was it like to watch him? Was it worse or was it worse to get it?
It wasn't worse. I think I was just a little dramatic.
No, you weren't. It's normal. How's your breathing right now?
It's good.
Did you crack on that last one? Did it make a cracking noise or just push?
Push.
Yeah.
Just push.
It's intense, right?
It's like really, really wedged or something. Like
Yeah.
I really hurt it, huh? I really pushed it in the bone.
Yeah. Yours was twisted. So you had, hers was leaning one way, all to the left. Yours is upper was going left and the bottom went right. So you had like a twist. Like I bet you were hit more than once in the nose. Yeah. Face first in a accident, right?
The accident was the back.
Yeah.
But when I was a kid, I was walking on top of those, those rails that those roads that cross a ditch,
Yeah.
and they got those little rails that they're slippery like this. And I was
Mhm.
walking on them,
And you
and I
slipped.
slipped and
Face planted.
I face planted.
Mm.
Cut my lip, but I had to get stitches. Lost my tooth, but my nose has never always been.
Yeah. So that's when you, did they say if you broke your nose? See, it doesn't really matter because you could not break your nose, but move everything over.
Yeah, I shifted something.
And a broken nose could be less than the smush nose. Like you have a little hairline fracture here, and they go, oh, you broke your nose, but the airway never got disrupted and you're fine. You could have an x-ray that says, no, you didn't break it, go home. But meanwhile, everything on the inside is smushed. So you just can't get air through it.
If I use that,
So I think that's worse, don't you think? A smush
Oh, yeah,
nose
yeah.
than a little tiny
Definitely.
crack that heals in 3 weeks. Because you've had a messed up nose for 40 years, right?
Long time.
Yeah.
Sinex, they know
Yeah.
the spray.
Yeah.
It opens it up,
Yeah.
but it goes right back
Then it closes.
and closes.
That's what
good.
mine feels
Yeah.
like.
Do you want to do more or are you good?
I think I'm good. I'm good.
You're good.
We got you
Yeah.
pretty good today.
Yeah.
I was really happy with
Good.
it.
That's good, but we definitely
Okay.
need to do about. You said about 7.
Well, when you can come back, when you're in New York, look me up, okay?
Yeah.
Thank you.
There's some good people in
you.
California that do this, though. I can show you the website, okay, how to find it.
Okay.
So if you decide to do more, you can maybe do it right in California.
He wanted to come here.
Because I'm the guy you wanted to see.
You're the
But I mean,
one.
if you decide,
like the
hey,
main
we should do
reason
it
why
again
I
in a
came.
month,
Take pictures with you.
yeah, we'll do that too. All right. Thanks, everybody.
Thank you.
That's good.